Okay, Commissioner, I believe we're ready to start, Mr. Chairman. Chairman, you're muted.
Thank you. We welcome everybody to this special meeting of the Eastern Idaho Public Health Board. I saw it reported on the news and also in social media that this was an emergency meeting. That is not correct. It is what's called a special meeting. A special meeting requires a 24-hour notice of the agenda and a posting of the meeting. And so I wanted to make sure that that was corrected. But we are meeting this morning on Monday, January 25th, due to some circumstances that arose at the end of the week last week regarding high school and, well, all school sports. And we felt like it was necessary to hold this special meeting, and this morning was the earliest that we could do that, but it did require a special meeting notice. We will begin this morning with a roll call of our board. So we'll start with our physician, Dr. Nelson.
Barbara Nelson, present.
Thank you. And Teton County.
Bill Lake, present.
Fremont County.
It says Bill.
Commissioner Dance.
Yes, Commissioner Dance, present.
Thank you.
Where's the?
And let's see, Madison County. Is Commissioner Mendenhall with us yet?
I don't see him.
Okay, let us know if he comes in. And next we'll go to Clark County
Commissioner Shenton, present.
and Lemhi County. Commissioner Madsen, are you hearing us?
We can hear you. Go ahead.
I hate this.
Okay, so, well,
Let me reach out to her.
okay, thank you. And let's see, we have Custer County,
Commissioner Butts, present.
okay? And I'm Brian Reed from Bonneville County. Did I miss anybody?
Commissioner Young from Jefferson County, present.
Oh, I'm sorry, Commissioner Young. I knew I had, but I couldn't quite place it, so thank you. Let's see, Commissioner Madsen, are you hearing us yet? Well, she's continuing to work on that. Let me mention that we are holding this meeting on our YouTube channel, where it is being streamed to view currently or late at any time. There's also a room set up at the building of Eastern Idaho Public Health where the public is able to go to the meeting location and view the meeting, where we have staff and others present.
Mr. Chairman, could we please just do a sound check with Commissioner Madsen? I have her on the phone.
Yes, so Commissioner Madsen, are you hearing us okay?
Yes, I can hear you now.
Okay, all right, thank you. Welcome, and we have Commissioner Mendenhall from Madison County with us. All right, very good. So we do have a full board this morning. We appreciate everybody's attendance on this somewhat quickly called special meeting. We will begin with a report from our board member on the executive committee, the state committee, Mr. Lake. I understand you had a meeting last Friday. Is there a report on that?
Yes, thank you, Chairman Reed. The Executive Council, which is made up of a representative from each of the 7 public health districts, met. We had a discussion about the upcoming legislative session that's in order right now, and discussed where we are and what's going on. And what we have is we have a lobbyist, his name's Mike Kane, out of the Boise area, who will be and has been going around and getting feedback and input from many of the legislators as to their thoughts about the role of public health districts in Idaho. With that, he gave us a briefing on some of the input he's gotten. And because in the legislature, you can't talk about or share draft statutes that are being reviewed and discussed at the legislative level. We couldn't get into any details on those in a public meeting. We did have an executive session where we were able to. Unfortunately, I can't share any of those details. However, I will say that the next step is he is going to be presenting to the state, Senate, and House Health and Welfare Committees to Tuesday, tomorrow, 1 in the morning at 9 and 1 at 3, to give them an overview of what public health districts do in the state of Idaho, which is significantly more than just dealing with a pandemic, which is pretty much the perception of probably a lot of folks in Idaho at this point. I also understand that Jerry and Commissioner Reed and myself will be traveling over there today to be at those hearings, to be able to answer any questions that the legislatures may have regarding our role in what we do and how we go about doing it. I think that's a great first step in getting the legislators educated so that as they go into deliberations about any future changes they would like to see with public health, it's from an educated perspective. So that's the end of my report. I don't know, Jerry, did I leave anything out that you think's pertinent?
No, I was muted. I think you covered it well. Thank you.
All right. Are there any questions from the board? Yes, Commissioner Mendenhall.
What time are those hearings tomorrow? Are they broadcast or anything like that?
We understand that they're working on that to have them broadcast at 9 o'clock and at 3 o'clock.
I would just clarify, Mr. Chairman, that all of the meetings are already able to be listened to live. If you just go to the legislative website and look on live streaming, you can pick whatever committee that you want to listen to, or the House or the Senate, but it lets you listen to the audio at least. We do know that some are having video capabilities now, but you can listen to the live and they are archived.
So 9 o'clock and 3 o'clock?
Yes.
Okay, thank you.
Any other questions? All right, we'll go ahead and move to the next topic on our agenda then, which is the COVID-19 situational report. Director Rakow.
Yes, I just want to show, visit the dashboard for a moment. Can everyone see that?
Yes.
Okay. I'm going to turn it over to James to talk about the data here for just a moment.
Yeah, so as you can see here, again, the numbers across the bottom are our district totals right now. As we sit here as this morning early, 384 active cases, 21 cases yesterday just coming in. And we have 30 residents of our health district currently hospitalized right now. If we can go to page 3, Jerry, the district level response. I would just want to show the incident cases by date here across the bottom. This right now is representing the whole district. Yeah, and if you want to cut down to like from November 15th on or something, yeah, right in there is fine. We're going to slice this data down to kind of our peak over here on the left, which was late November, kind of early part of December. And since that time, those two blank spaces kind of right there in the center right are actually Christmas Day and then New Year's Day. But really starting just about that time, we've seen a decrease in cases overall. You can see slight bumps after the holidays, probably with those data sets. Yep, that Jerry's pointing out, just about the January 7th and then just a kind of a week later on January 14th and the 15th, right in that time frame. Last week, you can see, certainly we always get less reports on Saturday and Sunday as providers are normally not open and not running as many tests. But you can see this last week, we've decreased quite drastically from our peak, certainly, and even from prior weeks. We're ending lower and lower in our total weekly case count each week. I will say that we were happy to see this. If we can go to the hospitalized, we're going to look at the hospitalized data now as well. You can see here over this line, again, a peak in kind of late November for total hospitalized, a slight bump up, a few weeks later, mid-December, getting close to that peak again. But since then, we've decreased. We had a slight increase kind of post holidays, you can see there, but right now we're sitting just at 30, so decreasing, and we're happy to see that decrease in overall hospitalizations. Again, this is just residents, so residents being a top of 61. You can see in the bottom left the COVID patients in the district hospitals. That's, again, our hospitals within our region, how many patients they're serving with COVID versus 30 that are residents of our district. So an extra 7 individuals that our hospitals are serving.
Back at the peak here in November, we had 80 people hospitalized in our hospitals.
Yeah. So you can see that from our peaks, we're certainly in significantly decreased, which is great news by ours. I just want to highlight on page 2, if we can, sorry, just go back to the county level. All counties are on a decreasing trend as well for the active cases. Now, I'm going to highlight two counties here specifically that besides Bonneville. Here you can see Bonneville had that almost same thing that we talked about from the overall health district, peaking in early December and then decreasing. We saw a slight increase after the holidays again, but now on a downward trajectory overall. I want to highlight Madison next here. Bonneville, Madison, and Teton are normally our ones that have right now currently having some of the highest rates. But again, you can see Madison show this quite dramatically, that peak, in early part of December, decreasing through the holidays. Again, that was probably some reporting lag from many facilities that were closed during that time. So increasing, but now on a decreased trajectory here down to 20.5 as of last night. Teton is one of our smaller counties, so there's higher variability throughout this. Again, you can see a slight, a kind of a peak late November there, or middle of November. And then another slight peak in early December portion there, late November, excuse me. They've had a resurgence as of late. Teton County, Wyoming, I will say, has found a new variant in some of their testing. As I know, just one individual. They haven't released any more data than that. We've had many questions regarding if Teton County's increase could be due to the variant. It's possible, but it's also possible that individuals that we have found were not necessarily doing all of those good public health recommendations sometimes over the holidays and traveling, and we've attributed that. I will say that this week, again, this last part of last week and and continuing, we're seeing a decrease in overall cases. Again, some higher variability. We're hoping that that trajectory of decreasing active cases continues to go down. So those 3 counties I wanted to highlight. Certainly, maybe we'll highlight one more, Fremont County. Yeah. Just, I wanted to highlight Fremont. 10 days ago, we rescinded the order from yellow to green. So since that time, you can see that we rescinded that order Thursday, January 14th. Yep, their rate was 7.6. They had a kind of a big day the next day with that up their rate. And last week they have had a number of cases reported fairly consistently that they have not had for a number of weeks actually, which made them end yesterday with a rate of 17.6. So they have been above that metric that stated in our plan of 15 for now 4 consecutive days, I believe. I'd have to
4 days.
Yeah, 4.
Well, more.
Yeah, 5 days potentially. So 6, if I'm counting 6, sorry. So 6 consecutive days they've been above that threshold now. So they've been the only one that's had an increase and not doesn't have a trajectory of a decreasing active case count. So good news, there is some variability in some of the smaller counties with some increases in some cases. That's been consistent throughout, the inconsistency or that highly variable case count. Overall, as a district, we're decreasing and we're excited about that. The overall active rate for the county is quite down from our peak. The peak being into the 60s. Now we're down into the teens for our overall cases, our active case count for the district, and very close to, and I know the hospitals are appreciative of the lower cases that they're seeing as they're dealing with many other factors as well that come this time of year.
James?
Yes.
May I interrupt you? Because I wanted to bring something out that I think is important. When you mentioned that approximately November 15th was our high, and that's approximately the dates that you're showing now, and it's been a fairly steady decline since that time. I think 2 things happened on November 15th that people need to be aware of. And that's number one, that's when the governor came out and moved us back to stage 2 and put that 10-person limit, I believe. Is that correct, Director Rakow?
Yeah, that was on November 14th. That order was revised.
November 14th. So that's interesting that when that happened, the entire state, not just our district, but has been on a fairly good downhill trajectory. The second thing that I believe contributes to that is the fact that we were seeing a lot of cases. Our hospitals were full. We were seeing deaths being reported, sadly, every day by Eastern Idaho Public Health. And I believe that the public took notice of that and really worked hard to try to do everything that they could, that we all can, to help slow the spread down, which I appreciate. And it just shows the ability of our public and all of us to do what needs to be done to help slow it down when the seriousness is so evident. But I think that you cannot discount the fact that when the governor did that, we've continued to go down since that time. It's more than coincidental. Would you agree?
I think you described both things there that have a major impact on these rates.
Are there any other questions from board members right now while I've already interrupted them before we proceed?
No.
Seeing none, go ahead and continue.
Actually, I think that you ended it well. I think that's the information for the cases that I had to display, or some of a few highlights, but I'll stand for any other questions.
Okay, we may come back to you. So we're going to discuss the vaccination rollout, which is so important right now.
All right, we're going to turn it to Amy to give an update on vaccine efforts and planning. So
good morning. Thank you, Commissioner Reed. So Idaho continues to receive about 21,000 doses each week. We are hearing maybe a little bit of a rumor the Moderna supply might be bumped just a little bit. CVAC met on Friday, more so just to clarify some of the priority groups, what populations might fit in some of those. We're waiting to see if the governor agreed with those recommendations or not. Statewide, the biggest, I think everybody's anxiety and preparation is for the 2.2 group that'll be coming. I think Jerry's showing some information as well. The 2.2 group that we're expecting to start February 1st, or the 65 plus age group. Perspective, there's about 290,000 individuals over 65, and we're getting about, roughly 21,000 doses a week. It's going to take us a long time to move through that group if that allotment stays that way. And so, demand will be high. Inventories will not be able to match that. Currently this week, we're trying to get through the rest of our 2.1. We're still continuing to see clinics, fill a couple days before. It's not a mad rush to fill through Friday, but we're definitely continuing to fill from those populations clear back, from 1.1 as well. Jerry has on the screen, and I'm sure this hasn't been updated since Friday sometime, people that have been vaccinated. So total doses at 82,000, first doses 54,000. And then you can see our health district has reported 8,203 doses. We have had some discussions with the state on potential of maybe inventory or administration not even just being put into IRIS. So maybe that's why that's showing low. They did just come out with a grant opportunity, a little bit of an incentive. If a vaccine is into IRIS within 72 hours, there's a little monetary reward for that. And so I think that will help as well. And then I just wanted to talk a little bit about, the allotments and doses coming in, but there is some lag time that sometimes this doesn't show. And so there's a little bit of a lag time from when CDC reports their allotment to the state, some lag time when we get that allotment into our building, when we're able to get that out to providers. And then, those doses we get on a Wednesday, we administer them throughout the week. So I start, get them on Wednesday, start on Thursday, and then hopefully we've moved through all of those before that next doses come on Thursday. And so sometimes you can have, a 10 to 14 day just a delay in the picture of it. When you start putting that to numbers, that can be anywhere, to 20 to 40,000 doses. And so I just want people to keep that in mind as well. We're also planning here at the district level, and James is going to get, I believe, into some more specifics on our planning for 2.2. Just here at the health district, though, I know our list just for notification continues to grow. And I didn't look at that this morning, but we're in the thousands and thousands. So we're preparing how we're going to notify that population, the things we're going to do to keep that updated on our website. We're looking at a call center here just to man some phones when those phone calls come in as well on that. And so we'll continue just to work on the messaging of that. This is kind of our new look. I can't remember if that was there. I don't think so at our last board meeting, kind of letting us know where we are in the priority group. And so again, we're right there eligible now through 2.1. If you click on that as well, we have links just here at the health department where you're able to schedule those appointments for 2.1 as well, which has been nice. Those on links has saved us a lot of phone calls at this point. Some people still will call to schedule an appointment, but these first early groups are definitely very tech savvy. And through 2.1, the majority of the appointments have been able to be online. And so that's been great for staff and for clients as well. And I think that is my update on our part. And then I stand for questions as well.
So let me start out since I'm seeing none, Amy. When I look at the deaths that have happened, when I look at the state website, 51% of the deaths have been individuals 80 and over. Just kind of roughly running the numbers in our health district, I've got about 43% of the deaths in our district have been 80 and over age group. It just makes me continue to wish that somehow we could divide this next group up and begin with the 80 and over to try to bring some management to this rollout of such a large group and to be able to vaccinate those that are really at most risk right now. And then work our way down. If you go to the 70 and older, it is the vast majority of individuals. I've got it at, well, 75% in our district. So what's our discussion on that?
So a couple of things I would add to that. Some of those, that age group are going to be in your long-term care facilities, which have already been targeted through the pharmacy partnership agreement and ours. In fact, the initial long-term care facilities that we went and did, we've already provided their second doses. The ones that we picked up for CBS, we're still a couple of weeks away. So I would say some of that population would be in that already being vaccinated group, which is good. I mean, that's good. And we have had conversations with the state, and I don't know if Jerry will want to add to that, if we're able to apply any stratification to that age group. The governor's expectation, clearly has been 65 plus, but there's definitely discussions around that this week. Did you want to add anything to that, Jerry?
I would just say that there has been, as Amy said, communication with the state, and we don't have, a lot of clarity on that. But we're continuing those discussions.
Are there other questions from board members?
Mr. Chair, Bill Lake.
Go ahead. First, we'll go to Bill and then Commissioner Mendenhall. Bill, go ahead.
I'm curious, do we have a database that we can go in and actually get the numbers by county, by age, so that we can see exactly how many people we're looking at in each age, 65 to on up?
Mr. Chairman, Bill, we do know that we have the population for our counties of those 65 and older. I do not know if we have it broken out by, increments of 5 years or, 70, 80. I don't know that.
So, Mr. Chair, Bill, if I may, this is James. I would, there's a few websites that dive into the demographics, mostly supplied by the census. So the census is what can provide some of that detail. However, the census does not provide a 75 to 80. They group from 65 and older mostly. We have used other emergency preparedness planning websites to try to estimate the number of population 75 and older, as we were unsure which the governor would elect to do previously, and do have a percentage of the 65 and older population for each county that is 75 and older. I'll just say it has limitations, certainly. So to answer your question, no, we don't have a list or any information about providing in each county how many individuals are 90 and over, and then 85 and older, or 80 and older.
Okay, and thank you, James. And a follow-on question, Mr. Chair?
Go ahead.
So with that, is there what is the plan for getting the word out to each of these priority groups, for that matter, as to when they can start scheduling? Or are we just relying on the webpage, the internet for these folks?
No.
No, so not just the webpage as well. So traditional media, and then I was talking about our list. Thousands of them have already called, and we have collected that information. And then we are going to send that out to just let them know that their priority group is available. So we plan on doing that. We're still talking about the day, but we'll definitely have phones being manned here, so we can talk them through where they can make an appointment at, and how to make that appointment.
There's also plans to widely disseminate that same information through all of our media channels, through the television news, through the newspapers. We're meeting with our all the enrolled providers today at noon to have some of these same conversations of what it's going to look like for each of the providers that are actually going to be receiving the vaccine. We know that some providers, there's pharmacies that are enrolled, there are hospitals, and then there are some clinics or private practices. And we know that some of those providers intend to only serve their patient population, whereas the pharmacies and public health will be serving the broader, the greater population. And so it is going to take some coordination. And I think even despite our best efforts, it's going to be very chaotic as this rolls out and becomes available to the 65 and older population, especially when we only have about 2,100 doses for our 8-county health district.
And if I could add just real quick, and then just our normal other traditional methods that we reach people for influenza, so our senior centers, some of those other places where seniors frequent will also have the information there.
Thank you.
Commissioner Mendenhall?
Yes, thank you. Amy, I was just curious, do we have a database that tells us when we have reached the group in 2.1, a majority of them, so that we can move on? How do we know in this large of a district, in this many counties, how do we know when we have reached those people in 2.1 that we are able to say, it's time to move to the next group? We have reached out and done all we can to get those people. And how do we know when we've reached that threshold?
If everybody was 100% uptake, then you could just go by that number that they've supplied for that. But that's where it gets complicated. We don't even know how many people want to be vaccinated. So we have to look at other measures. We definitely have looked at every list that we believe has been available to us to try and reach those targeted specific groups. And then I think just my appointments, every time we move into a new priority group, at least here at the health department, we would be, very busy for several days or weeks through that priority group. And then those start to taper off. And then we would move to the next priority group. And so that same thing would happen again. And so again, that's what I'm seeing right now. But no, I think people change their minds. And so we'll still see some back, or maybe they were deferred. Or maybe somebody just missed the information. But I think we've worked very hard to make sure those real specific targeted groups have been reached out to.
Okay.
Mr.
And one
Chairman,
last.
sorry.
Oh, go ahead. Go ahead. Sorry, Jerry.
Commissioner Mendenhall, just to add on to what Amy said, you can see here on this tentative timeline, and that's what I hope people understand, that it is tentative. We have several conversations every week with the Department of Health and Welfare and Governor's Office representatives, talking through all of these challenges. And we have another call this afternoon. And the vaccine rollout to the 65 and older priority group is our primary focus right now. As you can see with this timeline, and this is not, definitive at this point, but the way that it is set up is that early February, individuals 65 and older would be able to begin getting the vaccine. But then they had tentatively laid out that late February, early March, it would roll into that next priority group, which is again, a significant number of people. As Amy shared, we have about almost 31,000 people in the 65 and older age group in our health district. And with the amount of vaccine that we are being allocated, we anticipate it could be about 10 weeks if everyone in that group wanted to receive that vaccine. So we're just not clear yet on what timeline these additional groups will be added in, and that what that will do for accessibility for the 65 and older group. So nothing is concrete at this point. Daily discussions of how this is going to look.
Commissioner Mendenhall, did you have a follow-up?
I did. Just, it's more of a disturbing news. We hear, and I don't know if it's urban myth or what it is, but we hear of people who are not keeping their appointments. And when I hear a number of just 21,000 doses for the district, I know that these are temperature sensitive and time sensitive on the vaccines. How are we doing there? Are we losing vaccines because people just don't show up, or people decide at the last minute not to do it, and we sit there with a vial waiting to be injected and it's not there? What's our loss ratio? Are we being, not we as the public health district, are we as the public being irresponsible with these vaccines? How do we compensate? How do we help that out?
And so, yeah, we have had people not show up for appointments. We have not lost any vaccine because of that, though. At the end of the day, I don't know if you recall me last time talking about if there's extra doses at the end of the day, then we have a list that we've been able to call from the priority groups and have them come in and get vaccinated at the end of the day. When we move into 2.2, I think that's even going to be easier. I think we'll be able to call, individuals maybe for the next day's appointment to come in, and I think they will, or the next weeks. We're looking at how that will work. But that's functioned very well for us for the last several weeks, and I think that will continue to function. The downside of somebody missing an appointment, that just is somebody I didn't see that day, though, earlier on from that priority group. But we're still basically seeing the number of people that we have scheduled every day because of being able to pull those people in at the end of the day.
Okay.
I guess I would add to that, though, the people that are in the 2.1 and up, it's going to be harder for them to make up that appointment once we move into the 2.2 group. Right now, they've basically been able to schedule and get in a day or two. I suspect we'll be scheduled out a lot farther once we start into the 2.2. So again, we're encouraging them to get that vaccine right now.
Okay, thank you.
Are there other questions? Yes, go ahead, Bill.
Thank you, Mr. Chair. So the question is kind of a follow-on to Brent's, is what about people, are they signing up on multiple places just so that they can get in there? Or is there any issues with how that's being coordinated amongst the providers?
And so there's been a lot of dialogue with that. And that's, I think, part of that we'll find out more of that in our provider meeting today. But no, there is a potential for people to sign up on, at one facility and another facility. And we're trying to reduce some of that. But I think we'll know more after our meeting this afternoon, but definitely part of our discussion.
And Bill, I would just add that the priority groups that we've been doing right now through 2.1, which is right here, all healthcare providers that were in group 1 plus this section here, is a much more confined group. And we at Public Health have been closely coordinating those clinics with those groups. So for example, the schools, it wasn't just a free-for-all that teachers sign up wherever they want. We coordinated with our partners to actually go to that school and do a closed point of dispensing clinic for the school. For correctional facilities, same thing. We've had providers that are actually coordinating directly with those groups. So it's not like people are, signing up at multiple providers. That does change when it gets into this broader 65 and older group. And we are doing everything we can to message clearly that if you have an appointment and are not able to keep it with us for whatever reason, how critical is that it's canceled so it can be refilled with someone else.
Okay, and Jerry, that's the group I was talking about, that we start doubling up on these scheduling and things. I would like to add one other piece of information. It might be worthwhile looking at the voter registration databases that the counties keep, because in that database, and it's open for public information, we have probably most of people 65 and above, I would probably guess, are registered voters, probably at least 80 or 90% of them. And that might be a source if we needed to do a direct mailing or calls or whatever, particularly as Commissioner Reed, maybe to get the folks that are much older out there. So something to consider.
Thank you, Bill.
Are there other questions regarding the vaccine? I know this is going to be a huge effort from Eastern Idaho Public Health. Well, it has been ever since it rolled out, the vaccine, and it's going to continue to be for weeks. And I recognize the fact that you're all working just every day to try to get these vaccines out. I know that you are using some volunteers, and we mentioned before that people do that by going to the Volunteer Corps Idaho. Is that correct, Jerry?
It's Volunteer Idaho.
Okay, Volunteers for Idaho. And so we hope those who are able to will do that, and also hope that public will be patient to be able to and understand the enormous task this is going to be. But we do appreciate all of your efforts and hope that our doses, our quantity will continue to increase. Is there anything else you want to add, Jerry?
I do want to just make one more comment, because we do hear a lot about, getting the vaccine out quickly and the encouragement by the governor for other providers to sign on. We have 40 at this point providers and locations within our health district, and more continue to add every single day. And at this point, it's not a matter of having enough providers. It is solely a matter of having enough vaccine to get out. I can tell you that with the amount of vaccine that is coming in, like the 2150 that we mentioned before, Eastern Idaho Public Health could easily do that in a one-day clinic through a mass vaccination clinic. It's not that we're lacking in providers, we're lacking in vaccine, and all of our providers that are enrolled are very anxious to receive the vaccine and be able to start administering it as well. And so we are hopeful, as more and more vaccine becomes available, it will be easily accessible throughout our 8-county district for our residents.
All right, thank you. We'll then move to our next item on the agenda, which is a discussion and vote regarding the Idaho Rebound Stage 2 athletic plan. And now this came about at the very end of last week. We got an announcement midweek that the governor was going to make a modification to the plan to allow for more spectators in the school events that were happening. But we didn't know what that would be. And it came as a surprise to us. We didn't have any advance knowledge of this, but a surprise when he raised the capacity that could attend to the 40%. Well, when this happened, it immediately caused a significant amount of confusion with the public and with the school superintendents, because many of them quickly realized that the health orders that are in place from Eastern Idaho Public Health that allow for capacity of 28 square feet per person are more restrictive than the 40% that the governor changed it to. And so again, that the superintendents, rightfully so, they recognize this. And state law requires that when there are two orders in place, that the one that's the most restrictive takes precedence over the other. And so the superintendents defaulted to ours, which, as I stated, it just caused some confusion and, and some concern amongst those who had been petitioning and working with the governor, including many of our local state legislators, to increase that capacity. So that's what prompted really the need for a special meeting today. Jerry, do you want to explain any more?
I would just say that some of the superintendents followed our public health orders that are in place. Not all did throughout our health district, and some immediately implemented the governor's 40%. So again, that created more confusion within the school districts in our health district.
Yeah, thank you. That's correct. It was not the same across the board. And so the need came up today to, what do we do? Do we then modify our order again to match the governor's, or do we require them to stay with our order? In my conversations with some of the superintendents over the weekend, they actually indicated, one of them indicated that he felt like there was much more science and reason in our order than there was the governor's. But he also understood that the confusion that it causes, and said that he would support whatever action we needed to take today. I personally believe that it is possibly not the place of public health to go against the desire of the governor, and also the state legislators that have been pressuring the governor to then make this change. And then when he does, ours is in conflict to it. I think there's some real problems with that. I don't think the governor pulled that 40% out of a hat. There was something that went into the reasoning of why they determined that number. I don't know what it was, but there was something that made them choose that number. So I guess I'll just open it up to the board for discussion. And as we do, I'll also share that as I thought considerably about this over the weekend, I wondered if we're at a place now where we need to defer to the governor's control of this. We took control of this, last July or late June, July, when the governor turned it over to local health districts and asked us to control it and said he was stepping away. Well, in November, he took that control back somewhat, and it wasn't in conflict with us at that time. And now that it is, I just wonder if it isn't time for us to now step back and fall under the orders of the governor rather than being in conflict. So we've got two items on our agenda here we can discuss, but I'll just open it up to the board members for your comments.
Mr. Chairman, I'll start.
Yes,
as usual. I think we're in a very precarious situation here. Early on in this pandemic, as we put together these orders, as Jerry and her staff put together the orders and the direction for it was on an individual basis for counties, and then we massaged it and moved it to where it is now, which I'm very comfortable with. We received a lot of criticism that don't politicize the process, don't politicize the way that you address this, and we weren't. There was no politics. We were relying on James and his science, and Amy, and Jerry, all of them and their science, and we were making sound decisions. The precarious situation that I'm feeling that we are finding ourselves in, and I've been in touch with a couple of legislators, they're at odds with the governor. The legislature and the governor are at odds on how to take care of this pandemic now. It's a different animal than it was last April and May. Now they're seeing just the numbers that James had explained to us earlier today of perhaps going on a decline. And I'm not sure that, I don't know if they are interested in what's causing the decline. They're seeing the decline and they're reacting that way. The precarious situation that I see us in is if we have school districts that are, one is choosing the governor, one is choosing the health district plan, whatever fits their needs the most. I do know there is a nucleus of legislators that feel that even 40% is not enough, that they want more, and that they are pursuing the governor, and whatever discussions they're having between the governor's office and the legislature, if ours is more restrictive and we are under the microscope from particular members of the legislature that we have too much authority, that we're overstepping our bounds, that's the precarious situation. I hate to even speak if I don't have a solution in mind. I'm not sure what that solution is, but I am very concerned at what this does and what this portrays as different people vocalize it. Oh, look at the public health district. They're trying to hold us back while we're trying to rebound Idaho. The confusion is enough that I have thought about it since Jerry sent out the order and the plan of the governor. I'm not holding back that we should not massage our orders, that we should change our orders to follow the governor. I believe he has more publicity. People are confused. They don't know which is which, why, how come. I did not realize there was a state law that said you do the more restrictive, a health district or a governor's order. A lot of superintendents have done their own thing anyway. And so if they are more willing to follow the governor and it does not create an uptick, does not open us up for increased cases, I wonder if we shouldn't address our orders. Just a thought. I'm very concerned. I think we're in a very ugly rock and a hard place and all of that.
Okay, thank you. Go ahead, Bill.
Yeah, thanks, Brent. Thanks, Mr. Chair. I'll just share with you, I had a conversation with a parent who happens to be a county commissioner over here in Teton County. And here's the example she gave me, that there was a group that went to a hockey tournament not too long ago. And it turns out that one of the kids at the tournament went to the tournament with a runny nose. They played hockey for a day or so and then spent the night. They all got together, you know, tried to do the social distancing. The kids are out there playing. Turns out that on Monday, they find out that the kid with the runny nose is tested positive. There's 24 other kids about that were notified that you now have to go into quarantine because you were playing with that kid. And we know how kids play. They're not social distancing. So now what that means is that, assuming that those 24 kids are staying home now, which they're supposed to for 10, 14 days, now there's 24 parents who have to react to that, who some of them are not going to go to work. And I think that's the problem that we're facing here, is that it's not the number of cases that we're seeing out there. It's what are the implications to keeping our schools open, which is way more important right now than pretty much anything else that we can do. Because I know I've talked to lots of parents and it's a real burden for them dealing with those kids. So I think as we look at this, and I think the legislature and I think the governor, if you react too soon, it's going to get worse again. And we need to be careful that we don't overreact. And I'd be honest with you, I think the legislature is jumping into something that they don't understand themselves at this point, and that they can do what they want to do. That's their job. But a lot of times we need to kind of step back and look at the big picture and understand the details of what's going on, which we don't have that luxury right now. So I'll just share that one antidote with you and allow for more discussion. Thanks.
Okay, thank you. Other discussion, Commissioner Young?
Yeah, thank you, Mr. Chairman. I think my views are more in line with what Commissioner Mendenhall spoke about. When the governor first came out with his order of only 10 people in a group, I thought it was a little bit far reaching myself. It didn't make much sense on gymnasiums that had this large capacity and say the more restrictive order took place over ours. I really feel like that our health district has done a fantastic job, Jerry and James and the whole staff at our public health and leading us. And it seems like we kind of have been a few times we've been derailed by other orders. But I do feel it does create a lot of confusion when the governor comes in and does an order. And I do feel that his order, even though how unpopular it was in November, restricting the size gathering to 10, has probably saved lives. We don't know who those lives were, but it did, I believe, and it's also probably helped lead to the decrease. But I think that when they step in and give these other orders, it's kind of like they step out in the forefront, and that's who's going to be followed. And my feeling is when there's a conflict with our plan and the governor's orders is, I guess let's see how the orders from the governor works. Let's stay cohesive and let's keep one message and let's don't rile the citizens or the legislature to put public health in a bad light. And that's my thoughts, that we stay in line with what the governor wants to take charge of. Thank you. That's all.
Mr. Chairman,
Go ahead.
thank you. Just to follow up, and a question for Jerry, follow up with Commissioner Young. As you said, Mr. Chairman, the governor didn't come up with 40% out of the air. And I'm positive he must be consulting with Director Jepson and the State Department of Health and Welfare, that he receives his input from them and then makes the decision. Jerry, when the governor makes a decision like this that is direct with State Department of Health and Welfare, and a lot of people may not realize that we are a separate entity. We are not a branch of health and welfare, even though there's intermixing and all of that kind of thing that happens. When the governor has consulted with the Department of Health and Welfare, and we are somewhat connected at the hip, what's the expectations? Are we expected to follow that direction because it did come from input from the Health and Welfare Department? What's been the past? What's been the pecking order? Are we expected to, like we're doing, consider it, but are we somewhat expected to say, okay, we change direction because they have determined this is the best for the state? How does that political, and I'm just trying to avoid the political, but I'm sorry, it's been dumped into the mixing bowl. What's been the expectation?
Mr. Chairman and Commissioner Mendenhall, it's been a little bit confusing to say the least. While we're in close communication with the governor's office and with Department of Health and Welfare and try to stay as coordinated as possible, I know the governor has given the boards, the accountability to do what they need to do in our health districts. I can say that our health district has been a leader in that respect. And I know that there was significant concern for many other areas of the state back in November that not enough protective measures were being done in some areas. And so that was the desire of the governor to make sure that he was doing everything possible for the citizens of Idaho to save lives. I did have a conversation with a representative from the governor's office over the weekend, and there's no black and white. I mean, I think the is totally supportive of what our board is doing and direction that we're taking. But again, for the need to respond statewide for other areas that have not taken some actions, he has stepped up and done that. So it does put us in that position today that we have conflicting guidance for the public in our health district that is creating confusion and contention. So I don't know that there's an expectation. It has not been, described to me that our Board of Health, has to follow this. That's not the case. So I think our board needs to continue to do what we think, but also take into consideration that there's, I think a lot more attention is being paid to what the governor is doing statewide, and it's creating a lot of confusion in our health district.
I might add that spoke to some school board representatives over the weekend, and because I was concerned, if we were to set our plan aside now and follow the governor's order and do away with the current health orders from Eastern Idaho Public Health, that does not mean that this is over. I mean, it means that everybody needs to continue to stay home when sick, to stay socially distanced when out in public, to wash hands, to wear a face covering when they cannot maintain that distance. I mean, all of those measures that have helped Idaho and helped our area bring these numbers down and get where we are now, that all needs to continue. And I had a real concern that if we dropped ours, that what would happen, particularly in the schools. And so when I discussed that, I was really impressed with the feedback that I got back, that they believed that the measures that were being taken right now were helping, that it helped show that schools were not the main source for spread, particularly in school during the days. Activities may be a different situation where you bring spectators and parents together, but certainly within the students, there's not that spread going on, particularly in the schools where we see that they are following the health precautions. There are some districts that are not, and in those districts, you're seeing a higher spread. But in the districts that are, you're seeing a really low spread. And this school trustee told me that we'll still require it. Nothing is going to change. We recognize the need for it. We'll still require the face coverings in school and doing everything that they can to continue as we have been. So that made me feel better about the fact that, people recognize it now, and particularly these schools, and they'll continue to be safe. One reason that I felt like it may be necessary in time is because the public all knows. Everybody knows how to slow the spread now. We saw it evidenced after the middle of November when everybody recognized the great need and started to try harder. And of course, the governor's position have had some impact. But Eastern Idaho Public Health is going to be overburdened with the Herculean task of rolling out these vaccines right now. And I think that it's time now to allow the public to focus on keeping the spread low and to allow Eastern Idaho Public Health the time that's going to be necessary to roll out these vaccines. That needs to be where their focus should be. And we as a board help direct that and set their course. School districts in Teton County, they have every ability to enforce stricter rules at the schools, to restrict their activities for face coverings and mitigation strategies, as well as cities individually. So I personally believe that to not be in conflict with the governor's orders, that it may be time for us to simply set our orders aside and follow the state, which is what our legislators are wanting us to do. Dr. Nelson, I know I saw some, oh, I'm sorry. Before I ask my question, Dr. Nelson, let's go to Commissioner Mattson.
Yes, I'm just kind of curious on what maybe your guys' schools are looking like. I know we are having the frustration because our numbers are down, that they're wanting to see more participants at games or being able to do that. I don't know if it's just like in your schools, has it just been limited to just mom and dad, like parents going? And how do we go about directing which is the best avenue for each individual district or county?
Chair.
Yeah, Commissioner Mattson, and that's what we're talking about, the stage 2 order from the governor's plan. And he actually had a plan for school athletics. And what I sent out to you as board members, this modified one that came out, that is what the schools are supposed to be following. Prior to that, it was much more limited. But I can tell you even at that, while some school districts, like we said earlier, some school districts are following the order, some school districts are requiring masking, and others are not. And that's even with our local public health orders in place. And so I think it has helped, and for those school districts that have chosen to follow the guidelines that have been put out by public health as well as the governor, that they will continue to do those things. But that's where we are today. So
Commissioner Mattson, did that answer your question, or did you have anything else?
No, that answered. Thank you.
Yeah, no, thank you for the question.
Mr. Chairman.
Go ahead, Commissioner Mendenhall.
Well, in the statement that you made of withdrawing our orders, if we're looking for, I think, less confusion, and we're looking for one Idaho, we're looking for one area. Commissioner Madsen is absolutely correct. Madison High School, I know, was under the microscope at one time because it had the appearance that we were just throwing the doors open, and we weren't. But we hosted some football games and we did some other things that raised an eyebrow. And if we're looking for uniformity, if we're looking, and again, I do not believe the governor made a 40% declaration of attendance just out of the air. There was a lot of discussion and a lot of planning that went into that. In our plan, I hope I have the latest one that was revised the 20th of November. Do I have the latest one, Jerry? 20th of November?
yes.
Is that okay. In that plan, it does have a bullet under public health mitigation measures. It has a bullet under there: schools should implement their school board approved plans for the various levels of community transmission. Schools now have an absolute direction pointed right at them for their athletic events. Our 28 square feet is for social gatherings and events. Doesn't say schools, doesn't say it's for everybody. Schools now have a laser beam direction that they are to go. And I'm afraid that our confusion is going to overwhelm the good that we're doing. And so, Mr. Chairman, I really believe we need to take a look at either revising our plan to state that the governor's order on athletics is what all school boards should follow, and revise our plan that the social gatherings are just for that, social gatherings that are not specified in the stage 2 athletic order. Withdrawing the orders, all that we have, if we can do that and align with what the state is recommending without doing a lot of harm, and we would have to refer to James and Jerry and Amy, I think we ought to consider it. I think we need to get to where we're all on the same page of direction and numbers and science and all of that. And I know Dr. Nelson is probably has fingerprints in her armchair. But I just think I think we have a lot of confusion, and I'm wondering if we shouldn't reconsider our health orders and realign them with the state.
So let me
Mr. Chairman.
Go ahead, Jerry.
Sorry, I just wanted to say that it's not just with the school sports, right? That there is now a very definitive plan, but it's also with the limitation on gatherings for other activities where our plan allows 28 square feet per person, but the governor's order allows no more than 10. So it's more widespread than the school issue specifically. And that's why it's hard to have, two orders in place that are not consistent.
Yeah, and that's what I guess I would, and that's the 10, Jerry, is still intact. Is it still, this was just athletics that we're allowing 40%. And now we're going to start having people that are going to say, well, wait a minute, 10 people by the governor, 28 square feet for Eastern Idaho Public Health, 40% for athletic. How much does Walmart get? Do they get 60%? Do they, I do think we need one order. One that we're all coming off of the same route.
Well, and before I go to Dr. Nelson, the governor's revised order that allows 40%, it also requires face coverings, correct, Jerry? It talked about face coverings or social distancing. Is that correct?
Yes, it says specifically, local education agencies may allow up to 40% of their local school's gym capacity or up to 4 spectators per student, whichever is larger, if physical distancing requirements can be maintained or if masks are worn.
Okay. So I know in talking with superintendents, if they put 40% in a gymnasium, they're going to need to wear face coverings because they won't be able to maintain the social distancing requirement. And so it's not just, you open it up now to 40%. It's those other things. And I saw pictures of schools that they thought they were happy that now they were complying with the governor's order with 40%, but in fact, they were not complying with the order from the governor in what I saw. Dr. Nelson, the question I wanted to ask you, I know you provided me with some information about if we open up too early, there's really clear evidence that it is going to prolong the incidence of the virus spread, even with the vaccine, and which will result in more deaths across the nation and greater problems. And the report I read is very compelling, and I understand the logic behind it. I guess 2 questions, your thoughts on that, but also why is Idaho so low right now, relatively low, compared to states that are struggling so hard around us? And Teton County, Wyoming, struggling so hard, and cases going over the mountain into Teton, Idaho. What's your opinion of why we're so low when the rest of the country is struggling?
We don't have an explanation for that at all. But the concern is, and I was speaking with Dr. Butrigo yesterday, is some of these new strains are showing greater infectivity and some worse side effects. So we're clearly not out of the woods. And I think it's more important to keep the schools open. Sports are optional. And if we go this direction, there needs to be really good enforcement of the distancing and face coverings, or we're setting ourselves up for another huge increase in cases.
Thank you. The other thing that I've been wondering is, I know we have a small percentage of our populace who have been vaccinated, but we have a lot of natural immunity now because, our numbers are showing confirmed cases of slightly over 10% in our district, I believe. I'm a little rough on my numbers, but I suspect it's probably at least 2 or 2.5% or times that because of cases that are not reported and people who have been infected and some of them may have not even known it and they're carrying the antibodies. So I'm guessing we've got 25, 30% at least.
The problem is we're estimating it's going to require like 70, upwards of 70% to achieve herd immunity. So we aren't even close.
Okay. Is it fair to say that when we have 30 or 35%, that's 30% better than nothing, right? I mean, we have some degree of herd immunity, so hopefully we're not in quite as precarious of a situation. Is that fair to say, or would you not agree?
I'm not sure, because if you look at the herd immunity data, you're saying there's still 65% of the population that's vulnerable. I mean, that's a big number.
Yeah, it is. I would feel a lot better about it if we had our 70 vaccinated. That would make this decision much easier.
And Mr. Chairman, if I may, I know that just me personally seeing, and lots of reports still continue to come into us, so that people are becoming more lax with the protective measures that we've been talking about, with the face coverings, with the physical distancing. And regardless of any action that's taken today, for that very reason that we were just talking about, there is a large percent of our population that is not immune to this virus yet. And so we need to continue those efforts throughout this vaccine rollout until we get that high level, of immunity or protection for the broader population. So I would just call on everyone to please not ease up on what you're doing to prevent the spread of the virus. We need to continue that for many more months until we get to that level that the majority of our population has either been vaccinated or has some natural immunity to it.
All right, thank you. One other thing that I'll interject, and then I welcome more discussion, but we may be nearing time for a motion, is we started our mitigation strategies in our plan with the sole purpose of protecting hospital capacity for not just COVID, but for all emergencies, so that there was never a car accident and there wasn't a bed at the hospital to take them. And that became somewhat perilous there in early July, or when we reached our peak of 80 or 82 people in our hospitals. That was not a position that we needed to be in, or that we want to ever be in again. And not only were we seeing our hospitals full and very stretched, particularly with their personnel, but we were seeing multiple deaths being reported in the paper every night and through Eastern Idaho Public Health. And so, we don't ever want to get back to that point again. And I'm just so grateful that we're where we're at now. But with that said, now with the extra measures of treatment that physicians have to their disposal, I think that we're seeing a smaller percentage of cases that do end up in the hospital. I know our epidemiologist reported to me over the weekend that where it was over 4%, it's now in the mid 3%. So it's dropped about a percentage. So there has been some drop, but there's still, when you see 100 cases, you can expect 3.5 people to possibly be hospitalized because of that. So, we're certainly not out of the woods yet, and I appreciate Dr. Nelson's perspective on that. So we have 2 action items on the agenda. I personally believe that at a minimum, we need to follow the governor's order for the athletics plan, but that's just my personal opinion. I welcome more input. And I think because of the confusion, it might be time to drop our orders, but again, I'm open for a motion or more discussion.
Mr. Chair, Bill Lake, I'd like to discuss further.
Go ahead.
I'll take us back to this summer when we dropped the order in Teton County. Immediately, several businesses around us, the county and the cities, even though there were city ordinances in place to wear masks, put up signs said, masks are not required. And there was total confusion. And it took a while to get that back in place. And I'm all for, if we want to revise the plan, I think that's probably what we need to do. But a wholesale of doing away with the orders could have mass confusion in itself. So if we want to consider something like that, I think we need to consider how we might phase them out and do so by changing our plan to do that. And I'm all for, if the governor came out with different criteria for gatherings, incorporating that into our plan. I wish we had more detail on how he came up with the 40%, but assuming that there is some science behind it, that's fine. But I think we need to be very careful that we don't create more confusion by just getting rid of the orders. And I will say one other thing along those lines. The fact that the public health district issued an order tells people that we're serious about this. And I got to tell you, we have a good size of our population that if you do away with an order, they're immediately going to say, I don't have to do any of this stuff. We saw it and we know that's the case. Even with an order, we know that there's a high percentage of people who just are not going to do the right thing. So that group that's in the middle, there's a big group that's always going to do the right thing regardless, but there's a group in that middle that we're going to lose if we're not careful. So thank you.
Bill, may I ask you a question on that? Why do those businesses and the public respect our order, but they will not the order of the cities? I mean, the city has an order in place, so why did they not enforce it or require that of those businesses?
Well, again, the cities have nobody out there to enforce it for them, first of all, just like we don't have anybody out there enforcing our order. But I think the big difference is that people see public health as our orders are based on science, the best we have, and understand the cities and the counties are basically using our information, if any, to maybe do theirs. But I'm pretty sure, I don't know of any other cities or counties in our district that have orders. I don't think there's any besides those in Teton County. So I think people are relying on us to show the seriousness of this and the fact that we put an order out. Believe me, and as a group, we took a lot of heat for it, but I believe it was the right thing to do. And I'm glad we all stood tall to do that. So I just think that that's my argument for leaving the orders in place, changing the plan, and coming up with how we might want to phase them out. But with that phase out goes education, massive education. If you expect people to do the right things, you're going to have to educate them to why it's so important. So I'll turn it back over. Thank you.
Thank you. Is there other discussion? I know there's commissioner meetings are going to be starting here soon, so we're going to have to start wrapping this up. Is there other discussion? If not, I'd be open for a motion.
Mr. Chairman, just as a part of discussion, Bill, I think you might be on the right track. Again, turning to Jerry, if we adjust the plan, if we modify the plan, can we modify the orders as well? Where Bill, if we just drop everything, people will take that as, oh boy, look, we're free. And I think Dr. Nelson is exactly spot on. We can't let down our guard right now. Can we modify those orders? I have not read one. I apologize. I did not read one again. I have not read one for a month or so. Do we need to modify the orders as well as the plan? Do we need to do both?
Well, Mr. Chairman, the orders are based on the plan. So if you modify the plan, you would have to modify the orders.
Okay.
I guess one concern that I have is trying to continually modify our plan based on what other orders get put into place, it's going to be just a nonstop revolving door. And I don't know how to reconcile that with having, basically two people leading the charge for this response that are not completely on the same page. And so, I mean, believe me, we have talked round and round of what the best route would be. And I do not have a perfect answer because I don't know how we could revise our plan to make it, always be in line with what might come from the governor's office. And so then we're continually changing orders, continually changing the plan that also continues to create confusion in the public. So there's not a perfect answer here.
Chairman,
But we want one. We want a perfect answer. We want one, Jerry. We need a perfect answer.
So do I.
But let's go to Commissioner Young.
So, I guess in our plan, I think maybe we're just beating around the bush on this. So let's go right to the crutch of the thing. Most of our plan, I really the most controversial part of the plan is probably the mask mandate. Are we going to keep the mask mandate in place or not? Is that what we're discussing? I know we have other parts of the plan, but that seems to be the central part of it.
If we follow if we choose to rewrite the orders so that they follow the governor's athletics plan, which allows 40% in those events, we still have in place, well, actually the governor's 10-person limit is still in place for all other events, weddings, receptions, any other public event. And so that wouldn't change. That would still be under the governor's 10-person limit. The schools would be modified for ours to match the governor's, but then there would be the confusion of the only thing really left in place is the face covering order in our public health orders. So it really is mostly about that. Am I correct, Jerry?
As far as our orders that are in place, if we're going to follow what the governor's saying, we would, I think, eliminate the restriction on gatherings that's in our order, because that would solve the school and it would solve the 10-person opposed to the 28 square foot. So all that would be left in our public health order is the requiring for the face coverings in public when you can't physically distance.
And I think the public's at a place now where they're either going to comply or they're not. And certainly I hope everybody's past that and realizes the importance of wearing a face covering. It's like the example that Mr. Lake gave. A student shows up, he's got a runny nose. He should have stayed home, but he didn't think he was sick. For all of those reasons, it's important to do those, whether you agree with it or not. It's just something that helps. And so I think if it boils down to just that, it's time for the public to make the right choice on their own and do it without a health order. That's my opinion. Certainly everybody's got the ability to do that. And I'm just not sure when it boils down to that one simple issue, if that's the position that a government, branch agency should be involved in, is mandating that one thing. So we need a motion because we need to end. I'm happy to I'll follow the board's lead on whichever direction y'all want to go on this. But I do think we've had enough discussion. I won't cut it off if someone has some more input, but I would welcome a motion.
Mr. Chairman.
Bill Lake.
Yes, let's go to Jerry first.
I'm just thinking, in my head through this dialogue that, what we're doing now is going to do the same thing to Teton County, that we're saying, we're in this odd predicament with having conflicting orders. I guess if we were to remove it, it's not a conflicting order with Teton County while they still have theirs in place. But I just don't know if there wants to be any consideration given that, you do something separate in Teton County. But again, there's no perfect solution to any of this that we're discussing this morning.
Well, some legislation that is being strongly proposed and will be talked about tomorrow is putting it on that any health order from a public health district would then fall to the commissioners of that county to make final approval on it. So, I mean, that kind of goes with what you're saying, Jerry. I mean, that's the direction they're wanting us to go, and maybe that's how it ought to be seen here. If those commissioners want it left on, but I don't want to cause confusion throughout the district, and that's what we're trying to avoid. And so, I think we need to come out of this meeting with a clear indication of where we're going, so there's not that confusion that was created by the governor's action last week. Other comments?
Could we defer making any decisions until Thursday or another date?
I think that we need to, at the minimum, address the athletics. Those superintendents, those schools need to know our position on this because there's events that go on all week long. And we committed to hold this meeting today to make a decision one way or another so that they have clear direction. We can wait on the other part, but it would be good if we at least acted on the governor's 40% rule.
Well, with that said, then I would make a motion to notify the school districts that they should follow the governor's orders at this point until further notice from the public health district.
Does that give you clear enough direction, Jerry? Well, before you answer that, is there a second on that motion?
Commissioner Young, I would second that.
Okay, there's a second. So now I need to know, Jerry, does that give you clear enough direction for the school districts?
So I would like to just ask, does that mean just for me to inform them, we're not necessarily making any changes to the orders that are in place, but to communicate to them that we support them following the governor's athletic plan? And they would be exempt from the 28 square foot limitation on gatherings.
That was my intent, yes.
So I guess that just, I'm not clear if I need to actually, if we need to amend the orders that are in place, or if it's communication to them right now and we'll take up at our next meeting specific amendments that need to be made to the order.
I think it will require an amendment to the order because the school superintendents I visited with, they wanted to know that that order had been changed so that they're within the law. And I appreciate them and their responsibility to follow the orders in place, but it would require an amendment to our order.
And Mr. Chairman, to substantiate that comment that we made at the beginning, that we have to follow the more restrictive order by simply notifying them the orders are still in place and we would be in violation of the more restrictive. I think we need to, if we're going to make this change, which I do support, we need to make the change so that they have something to take a hold of.
Would you be willing to amend your motion, Bill, for that?
Mr. Chairman, some discussion before considering amending the motion. I mean, if we're going to do that part, again, do we want to just eliminate the gathering restriction altogether so that that's not in conflict with the governor's 10-person gathering limit?
Seems like that would make sense. If you would be willing to do that, Bill, I would recommend that you withdraw your motion and then make a new motion.
Mr. Chair, I withdraw my motion and would make a motion to amend the existing orders in the public health district to reflect the requirements laid out in the governor's order and to remove the gathering limitations in the current orders.
Okay, is there a second to that?
Commissioner Young will second that again.
Okay. So there was a motion on the floor. It was withdrawn. So it does not require us to vote on amendment. Instead, we have a new motion that would instruct our director to remove the gathering limits within our order. So the 28 square feet would be removed. And that way there would be no conflict in the current governor's order. Is that correct, Bill? Did I state that correctly?
That is correct.
Okay, so there's a motion on the floor. Does everybody understand it? And is there any discussion on that motion? Hearing no discussion, I'll go ahead and do this by just a simple majority. All in favor, say aye.
Aye.
Is there anyone opposed? And
I
did
abstain.
Okay, and there was, so if I heard that correct, Dr. Nelson, you abstain from the,
Correct.
okay, thank you. So the motion passes with one abstention. Is there anything else, Director Rakow?
No, I believe that would be it for today.
Okay, so thank you very much, board. I think we had a good discussion. We had good dialogue. I think we reviewed everything really thoroughly. I appreciate the input from everyone. I especially appreciate the expertise of Dr. Nelson and to help us use caution as we proceed forward. Is there any other comments before I close the meeting? Okay, we'll close this, bring the